I'm Alex Savidge from KTVU Fox 2 News in the San Francisco Bay Area. And the coronavirus outbreak is especially concerning for the millions of Americans who are living with diabetes. And joining us now to talk more about this issue is Dr. Bob Eckel, who's the American Diabetes Association President of Medicine and Science. Dr. Eckel, thank you so much for taking the time here to discuss this very important issue here. So what do we know broadly about the risk of during this outbreak for those who have diabetes?
Well, Alex, we really don't know that much about risk. In other words, are patients living with diabetes at greater risk for COVID-19 infection or not? We're not quite sure yet. But what we do know is we want to prevent this infection in patients with diabetes because the outcomes may be less favorable.
And so that's, I think, the key. We're not seeing any data or any research that suggests someone with diabetes is more likely to become infected with coronavirus. It's just the outcomes are more likely to be severe. Folks be getting more sick and potentially dying.
That's right. And data from the Centers for Disease Control here in the US have shown that if you look at hospitalized patients, it's 3 times more likely that those patients have diabetes, and many of those end up in intensive care units and need assisted ventilation. So we're talking about an outcome that may be more complicated and less favorable.
And do we have a breakdown in terms of the number of deaths from coronavirus we've seen in this country? Do we know how many of those patients had the underlying condition of adult diabetes?
No, we don't know yet exactly what percentage of those patients who have fatal outcomes from COVID-19 have diabetes. I think the number of deaths continue to climb, and as they do, I'm sure that data will be available.
Okay. You talk about trying to obviously keep that, this is your role, is trying to keep Americans who are living with diabetes safe during this outbreak. What are you telling people who are living with diabetes, especially those who are older, the folks who are over 65? What are the words of advice that you would give them to stay safe?
Well, I think age is relevant, and many patients with type 2 diabetes, unlike type 1 diabetes, are older. So the advice is stay isolated as much as possible. Clearly, the strategy for prevention in the country as a whole relates to patients, particularly with type 2 diabetes or other underlying conditions like heart disease and lung disease, et cetera. Secondly, I think it's good to have our patients know that they have plenty of medications. We can't run out of insulin if you're on insulin.
Yeah,
If you have type 1 diabetes, because all patients with type 1 are on insulin, but for type 2, some are on basal insulin and need to make sure they're well stocked. But many other medications are on board for patients with diabetes, patients with lower blood pressure, patients that are medications that relate to lipids like cholesterol lowering, et cetera. Patients with diabetes are often on other medications for treatment or prevention of outcomes of diabetes that are more common, like kidney disease and heart disease. So this is very important. Thirdly, I think what we've learned from SARS-1, actually most people don't recall SARS-1, but SARS-1 occurred around 2001, right. 2002, and the outcomes then were less favorable for patients with diabetes, but it appears that people who controlled their diabetes optimally at that time, and that may not be as optimal as they are controlled today. We know better glucose control may be better suiting the patient with diabetes in terms of outcomes that relate to hospitalization and death. So we do have that information to advise our patients with diabetes.
What is it in particular about the disease that puts people more at risk during an outbreak like this? Whether it's the coronavirus like we're seeing spread around the world right now, or whether it's SARS as you talk about. What is it specifically about diabetes that creates so much of a risk?
Well, first of all, we know that patients with obesity, but particularly with type 2 diabetes, have this kind of chronic low-grade inflammatory state. They tend to have an immune response to insulin resistance, which I think is the common theme for this alteration in immune response, that is a low-grade kind of inflammation. Now, when they're presented with infection, whether it be a virus or a bacterium, ultimately the ability to mount an immune response is altered, and glycemic control may play some role in that. So we have two types of immunity: innate immunity, which is our ability to defend ourselves against any violation, including infection with a virus or bacteria. And then there's adaptive immunity. Once infected, how do we deal with it more, in the next several days, a few weeks to follow? That is also important. Now, both those responses, innate and adaptive immunity, both altered in diabetes.
Let me get back to the issue of medication, because you alluded to that too being so crucial here during this time. What are you hearing from people around the country who live with diabetes about their ability to be able to continue to get the insulin medicine that they need during a time when we are seeing most states with stay-at-home orders and obviously a great demand at our local pharmacies too? Are people having any difficulty getting insulin right now?
Well, since COVID-19 infection, Alex, we don't have any data to turn to in terms of difficulty in getting medications. I think it's just important for the American Diabetes Association and healthcare professionals who treat diabetes readily in their practices to assure their patients that they have adequate supplies of medications, including insulin, which, as you know, has been more costly. And that's another news item that the ADA has been very involved with. So making sure people have drugs on hand.
Yeah, that is so important. And I know, obviously we have no vaccine for coronavirus, and we hope that at some point that's going to be coming. But we do have a vaccine for the seasonal flu. Beg your pardon. 1 second. I don't know what happened there. An incoming call. I beg your pardon. It's the world we're living in. But we have no vaccine for COVID-19, for the coronavirus, but we do have a flu vaccine. And I imagine, another sound bit of advice to remind folks is that if you are living with diabetes, make sure you got your flu shot too.
Absolutely, and there's shots also that are available for pneumococcal pneumonia, which is a common disease of older people. Those should be given to patients with type 2 diabetes also. And then varicella zoster, or in other words, herpes zoster, which is affecting certain aspects of the body that, chickenpox as a child. Those vaccinations need to be up to date in patients with diabetes too, in addition to other people who have immunocompromised with aging.
When you step back and look, I mean, obviously it's so early on, you really, in the grand scheme of things, it's so early on in this outbreak. So as you've sort of alluded to in our conversation, the data is limited in so many respects. What more, as someone who looks closely at this issue here, what more do you want to learn about the link between diabetes and the coronavirus and the risk factors that exist?
Alex, lots of unanswered questions. First of all, are people with diabetes at greater risk for COVID-19? We're not sure yet. I think we don't know yet whether glycemic control is important in prevention and or in therapeutic decision-making in patients who are hospitalized or have COVID-19 who remain at home. We also don't know whether medications may be preferentially beneficial or less likely to be beneficial for patients with diabetes. Vaccines are really a year and a half away to be proven effective. So we can't look to that in the near future. But we've heard the executive part of our government talk about hydroxychloroquine. Right. But there are other antiviral drugs that could be utilized that may be important in treating this disease or even in terms of prophylaxis. Just don't have enough information. And I think, Alex, it's important to point out, information is increasing day in and day out. So you're going to be on the news for a while with stories about COVID-19, but also
I know
how it relates to people with underlying diseases like diabetes.
Yeah, absolutely. Well, I mean, and I obviously the folks who are getting extremely sick here, and who unfortunately are dying from the coronavirus, as you know, I mean, they have underlying conditions, and one of the ones we're seeing
absolutely
is diabetes. So, I mean, I know you guys are going to be working hard to study that link and try to figure out how it is that you can help folks in this country.
Well, Alex, one thing we've learned from China is that patients with diabetes have more difficult courses once they're COVID-19 infected, including a higher likelihood of dying from the infection.
Yeah.
But it seems like from the Chinese experience, much of that death risk, if you will, relates to existing heart disease in the presence of diabetes.
Okay.
So we know that many people with diabetes have heart disease, and there are many people with diabetes who have heart disease who don't know they have heart disease.
Mhm.
So this is something else in the United States we need to pay particular attention to, the coexisting patient who's older, has diabetes, and also has coronary heart disease or a history of heart failure or atrial fibrillation, a common cardiac arrhythmia that we see in patients with and without diabetes.
Yeah, it's these compounding underlying health conditions that all they all come together and pose a great risk for a lot of folks. Doctor, as we wrap up here, your final message to is the number still? It's about 30 million, I think, is what I read. 30 million Americans in this country who are living with diabetes. What is your final message to them about the best ways to try to stay safe and the steps they can be taking at home to keep themselves safe during this outbreak?
Right. The exact number, Alex, is 34 million people have known diabetes. There are many other people who have diabetes who haven't been diagnosed, and many people with what we call pre-diabetes who are at risk for diabetes that don't have it. The major message for people with diabetes is avoid the infection.
Mhm.
So we have to follow governmental guidelines from the White House, the CDC, the NIH, the governors, the local mayors and city councils, and what their recommendations are to stay safe to begin with. People with diabetes need to pay special attention to avoid infection. Once infected, they need to follow the advice for screening. Do they need to be screened if they have a mild fever and a cough? Perhaps. But if they're having more symptoms, such as cough with high fever or shortness of breath, they need to get to the emergency department. We need to be aggressive in identifying people who are at high risk, who have infection, get them hospitalized and be treated as aggressively as we know how. And controlling their blood glucose, this is probably an important time to make that very important for people who are at home and not infected, or people at home infected, or in fact, people in the hospital who are being managed within the hospital space.
Yeah, keep those levels under control, especially at a time like this. We certainly appreciate you coming on. I know this is such an important issue for you and for millions of Americans, as you talked about. We will leave the conversation there. Really a pleasure. Thank you so much for taking the time. Dr. Bob
You're
Eckel,
welcome.
American Diabetes Association President of Medicine and Science. Great information. Really appreciate you coming on. Thank you. And we should let everyone know out there that if you want more information during
Stay
this
well,
outbreak,
everyone.
yeah, absolutely. Stay well. That's the best we can do, is just to stay at home as much as possible and try to avoid this infection. I want to let everyone know that you can find more helpful information. We have it up at our website, coronavirusnow.com. I'm Alex Savidge from KTVU Fox 2 News in the San Francisco Bay Area.